We next have our resident advocate for healthcare professionals, Ms. Katz.
Thank you, Mr. Chairman. I want to thank thank you each of the witnesses for your excellent testimony. It's wonderful to see us with different stories to tell, but on the same page. I want to divide my time between Ms. Fortin and Ms. Julie Beckett for my time. Ms. Fortin, as a nurse myself and having extensively worked on critical issues surrounding the nurse shortage, I'm particularly sensitive to recruitment and retention difficulties faced among the direct support professional service. This is going to be a carry-on with after the ranking member, but I'll put it on to you to ask you to see a connection between the delivery of quality services and the wages of direct support professionals. Help us understand the negative impact that low wages have on quality support and on the choices people with disabilities have for where and when they receive supports. The choices being a predominant theme. Just a brief answer on that, please.
From our experience in New Jersey, with recruitment and retention of direct care workers reaching critical stages, it creates a revolving door for the direct care workers to work with the individuals. It affects the quality of care. If you have a different person coming in each month or each 6 months, that person has to start all over again to learn about the significant needs, especially for the folks that we work with who have intellectual disabilities. What we are looking at in New Jersey is we have a statewide coalition for a direct support professional workforce. We are looking at ways in which we can professionalize the career of a direct support professional through training, through support, and of course we're very, very supportive of the federal legislation which you sponsored, because we can see that those funds being able to come into New Jersey will help to create added funds to compensate the direct care workers. If we're able to stop that revolving door of direct support professionals coming through the system, we're going to be able to build that base, create the stability, and in the long run have the funds. Right now, just within the arc of New Jersey, we can look at vacancy rates in programs from anywhere from 15 to 40% in some of our residential programs. It costs thousands of dollars every time a direct support professional leaves and a new person has to be trained. We can take those funds, we can invest them in the salaries for the direct care workers, and we can begin to catch up on that system.
Such a good response. Thank you. Just for the record, what's your greatest competition for qualified direct support personnel? Where do they go to work instead of coming to work for you?
They go into the private sector and not necessarily in health care.
Right.
It pains me very much to hear people say how much they love their work, but they're going to go have to work for a private company in things like administrative support just because it pays the bills and it has the benefits.
Some of our workforce tell me that they get recruited by fast food places, yes. and that's a sad day when we compare ourselves with the kind of work that you do to sell hamburgers. Well, I could ask this next question of any of you, but I want to speak now to the disabilities in school. A number of years ago, there was some controversy with Medicaid services provided to children with disabilities in school. Some rather unscrupulous consultants traveled around the country, sold states and schools a bill of goods with less than satisfactory results. This mess was fortunately straightened out and things were put back on track. However, right after Christmas, CMS put out a final rule that would severely restrict access to Medicaid coverage for certain legitimate activities, and particularly specialized transportation for severely disabled children who receive medical services during the school day in school, and administrative outreach and enrollment activities to find and enroll more children in our schools. Ms. Beckett and anyone who would want to comment on what CMS's rule would mean for children with disabilities. For example, a child who needed a respirator-equipped bus to get to school.
Well, thank you very much for asking that question. I think the impact in particular would be on the types of things that children need, such as the therapies and all of that. The transportation issue is getting them where they can get the best services, and requiring, the different requirements by different individuals, particularly young children, forces school districts to think about, instead of serving them in school-based programs, actually serving them at home, which then restricts the socialization and all of the things
Exactly.
that really are necessary. So it's extremely important for us to look at what this proposal or what this implementation could possibly mean, and I would hope that somebody would be monitoring what the impact would be, particularly on school districts. I just was in Oelwein, Iowa. It's about an hour and a half north of Cedar Rapids the other night, as they talked about closing a particular program for second graders. It's simply because, you know, of the cost and the kinds of things. And the mothers who came out in droves saying how important it was for them not to think about this as a cost issue as much as to think about it as a personal issue for their child, and that these were children who needed that kind of care. It's important for us to think about the types of administrative costs that currently schools endure to help provide the best special education services they can for these children and their families. And in many ways, in many areas, that's the only thing they're qualified for.
Exactly.
They're not qualified for Medicaid. They may not be qualified for any other program. And it's really appalling that we could take that kind of a service away from those kinds of kids.
Thank you so much. In other words, the CMS ruling goes directly against the principles of IDEA, and so we do need to address it. And I thank you for your answer and for my time.